Good morning to all. I am Dr.M.Subbiah. Today I am going to discuss about Nifty cup for infant feeding. The WHO recommends hand expression of breast milk and the use of a small cup to feed newborns with breastfeeding difficulties in low resource settings. Cups are more easily sanitized than bottles and they only require that the infant be able to swallow and breathe, which demands less energy and skill than bottle feeding. Non-specific cups such as bottle tops, medicine cups, paladai, and generic drinking cups are used commonly along with spoons and syringes. Despite evidence that cup feeding is a safe, effective method for both term and preterm infant feeding, there are disadvantages of cup feeding. So cups made of metal or hard plastic can cut the thin skin of the oral commissure of the preterm infant, thereby it increases the risk of infection. Moreover, conventional cups are too small for hand expression of breast milk, which means breast milk is transferred from other, possibly a contaminated container prior to feeding to the newborn. So most infant feeding cups have relatively wider rims. So the wide rims on generic cups make it difficult for the inexperienced new mother to control the rate of milk flow to a newborn's mouth. And improper flow rate results in spillage, stresses the infant, and it can cause the infant to cough or aspirate. So one of the biggest limitations of cup feeding is spillage. So it was reported as much as 30% for every cup feed. Over a short period of time, this poor cup feeding may quickly result in chronic insufficient caloric intake that increases a vulnerable neonate's risk of undernutrition, failure to grow, infection, and death. So the paladai is a 10 ml pourable spouted cup with a long and narrow spout made of metal that is widely used in South India. So the metal material, it may injure the infant's mouth. The device is too small to capture hand expressed breast milk, and the long spout may result in an inexperienced feeder pouring milk into the infant's mouth rather than providing milk in response to the infant's sucking and swallowing pattern. So to address these problems with the feeding cups, a team of investigators from Seattle Children's Hospital, Bath, and the University of Washington designed the original neonatal intuitive feeding technology cup. So this is the Nifty feeding cup. So the Nifty cup is a new cup designed specifically for infants with breastfeeding difficulties, focused on addressing design drawbacks of the paladai and other cups used for feeding infants. So the Nifty cup is made of soft silicone material which makes it easy to clean and it prevents injury and is large enough for direct hand expression of breast milk. The 40 ml design optimizes the feeding experience for the infant and feeder. By making it easy to pace the feeding and control of milk flow, the spillage, regurgitation and duration of feeding may be minimized. The Nifty cup can provide an entire feeding to a preterm infant in a single cup given its size, whereas multiple refills of the 10 ml paladai is likely needed. So mothers prefer the Nifty cup over a medicine cup to feed their preterm infant. The Nifty cup was used with greater ease and confidence, and mothers were more likely to hand express into the Nifty cup. So among caregivers, the Nifty cup as compared to the paladai was less problematic on most parameters including spillage, regurgitation, difficulty in use and duration of feeding. So take home message, the Nifty cup is a promising feeding cup for feeding infants with breastfeeding difficulties to support growth and nutrition. So these are the references. Thank you.